My next video is on male genital organ, where I'll be telling you the layers of the scrotum, which can be asked as a precise question, and then I'll be starting with testis. So layers of the scrotum: skin. There is no dartos muscle, there is no superficial fascia because it is replaced by dartos muscle. Okay, so replaces superficial fascia, dartos muscle replaces the superficial fascia, then external spermatic fascia, cremasteric muscle and the fascia, and internal spermatic fascia. These are the layers of the scrotum. Then comes testis. This is the male gonad. It is homologous to ovary in females. Shape is oval and ellipsoid. It is hanged or by the spermatic cord. The upper pole is forwards and laterally. Lower pole is backwards and medially. Okay, so the upper pole is forwards and it is mediated laterally. The lower pole is mediated backwards and medially. Okay, now the external features: there are two poles, upper pole and lower pole, which I have already talked. Two borders, anterior and posterior border. Two surfaces, medial and lateral surface. Medial and lateral surface, anterior and posterior border, upper pole and lower pole. Okay, now this is the testis. This is epididymis, the sinus of the epididymis. You need to always remember that the sinus of the epididymis is always on the lateral aspect. Okay, it shows the lateral aspect or the lateral surface. Now anterior border is more or less rounded. Okay, whereas the posterior border is flat. Okay, this is rounded, this is usually flat. Okay, and then comes the coverings. There are three coverings: tunica vaginalis, albuginea and vasculosa. Okay, the persistent lower portion of the processus vaginalis. So this you need to draw the diagrams, and as you can see, testicular artery, this is the plexus, external spermatic fascia, scrotal, this is skin. So all the contents of that has descended through as the spermatic cord from the inguinal canal has reached in the testis. Okay, now the coverings are tunica vaginalis, albuginea and vasculosa. Okay, now tunica vaginalis processes, it is the persistent part of the processus vaginalis. Now this invaginates the testis from behind. Okay, and it presents parietal and visceral layer. It divides it into parietal layer and the visceral layer. Okay, and between them a potential cavity exists. So between the parietal layer and the visceral layer a potential cavity it exists. Then comes albuginea. So albuginea, it is thick and dense fibrous tissue encloses the testis. Okay, it is a thick fibrous tissue and it encloses the testis. Posteriorly it is thickened to form the mediastinum testis. Posteriorly it thickens and it forms mediastinum testis. It divides interior of the testis into 200 to 300 lobes. Okay, and then it divides the testis into 200 to 300 lobes, and each lobe is divided into 2 to 3 seminiferous tubule. Okay, and each lobule it divides into 200 and 300 lobules, and each lobule is contains 3 to 4 2 to 3 seminiferous tubules. They form straight tubules in the mediastinum. Okay, now they form straight tubules in the mediastinum, and then they form that is called testis. So in the before the mediastinum, inside the lobules, it is highly coiled. So as these tubules they come out from the mediastinum, it becomes straight, and now these straight tubules are called retate testis. Then they enter the epididymis. This is the epididymis, and here maturation, storage of the sperms occurs, and then it is transported through vas deferens for ejaculation. Okay, my next video I will be doing the rest of the part. Thank you.